Hey guys, this is Ashley. I'm a personal trainer and I've been training for about 7 years now. And I love to do weight loss coaching in particular and help people to lose weight because personally I used to be overweight and I struggled with my weight a lot. And eventually, once I figured it out through trial and error, I got really passionate and driven to help other people do the same. So I want to help you guys with your weight loss journeys. But today I want to talk to you in particular about how we can modify or change your exercises so that if you have bad joints, a bad knee, shoulder, maybe some back pain, issues like that. Now, I do have to put a disclaimer on this. If you have pain and you haven't been checked out already, definitely get to the doctor, get it checked out, find out exactly what it is, and see if the doctor approves an exercise routine for you. If they give you the green light to exercise, then great. But if they don't, or they say, hey, you gotta do some physical therapy first, of course, follow the doctor's recommendations, do what they've recommended for you, and then try to exercise after they give you that green light. We want to make sure we do that because not every injury, everything should be fixed with exercise right away. You may need to rest it a while, do whatever they suggest, and then go back to your exercise routine. Let's talk about a few body hacks, a few different ways that you can make changes that are going to help you to exercise. And I want to recommend here real quick that if you are a young person watching this and you don't have any aches and pains yet, you should still watch because one day it will be you. But also share it with your parents, colleagues, coworkers, people that you think might be able to benefit from it, because there's a lot of people going around with aches and pains today and they're just working out, pushing through it and not really knowing what to do. Hopefully this video is going to help them. I'm going to give you some tips today that will help you to reduce any pain you're having when you're doing the exercises. We're going to do 3 different tips and I hope that they help a lot. The first one might seem a little bit intuitive or really basic, but it needs to be said. Before you start exercising, practice the movement you're about to do. So if you know you have bad knees or a bad shoulder, do the exercise one time through and see how you feel. I would recommend going very slowly the first time you try the exercise. So for example's sake, let's say you have a bad shoulder and you decide, I'm going to do some push-ups. Don't just jump in and do 15, 20 push-ups, because you may find that you end up with a lot of pain, or the next day, 2-3 days later, you're having a lot of pain and then you don't want to do it anymore. Instead, what I recommend, if you know that about yourself, the day you're going to exercise, do a little check-in, see how you feel. Is it a good day for you? Is the shoulder okay? Is it already acting up and you haven't even started? And once you know how much pain you're feeling or how good you're feeling, try the exercise very slow with control and see how it feels. If it flares up in the middle of the exercise, we want to go slow enough to know at what point are we feeling the pain. Let's give an example of doing a bicep curl. Let's say you have a weight and you're doing a curl motion. You want to go really, really slow so that when you hit that point that it's starting to have pain, you want to be able to say, okay, right about here, that's when my elbow really starts acting up. That's it. That's the spot. So there's 2 different ways we can adjust for that problem. The first is to reduce the weight. If we're working with weights and you're doing something like a curl, maybe drop down to a weight that's you may feel is too light for you. Your muscle might be able to do more, but that joint may not be able to keep up with the muscle. Try reducing the weight and see if you can get a full range of motion without pain that way. If you can, you may need to start there. We definitely don't want to have any pain, but it's definitely good if we can get that full motion in because we're going to deeper engage the muscle. So we want to do that. If you find that you reduce the weight and you try and you're still having that pain, you may need to do half reps and not do the full movement and build up. So start with half reps and slowly over time, you'll see that you're able to do a little bit further in that motion and just go as slow as you need to go with that. That first tip is you just want to make sure you go slowly, try the exercise first, don't jump in, say you're going to do 30 and see what happens. Do 1 or 2 test trials, see where you're feeling some pain, and if you need to make some changes because of the pain, make those changes and then start the exercise. Tip number 2, things that we can change or modify to help you with your exercise. You want to reduce the pressure on the joint as much as possible. So what does that look like? Well, let's say you're doing squats, but you have a bad knee. And every time you do squats, that knee just acts up. Well, what if you were to put a ball behind your back, like a yoga ball, go against the wall, use that and go up and down rolling in that motion. This is a common modification that people do, and usually it helps a lot with any back pain, knee pain, because we can make a lot of adjustments from here. If you take your feet and walk them out a little bit further so that they're not at the traditional 90-degree angle of a squat, where your legs are here, your thighs are here, and as you come down, you come to about a 90-degree angle and then go up. If you walk your feet out a bit, we widen that angle, and that's going to reduce the pressure on your knee. Give that a try. See how that works for you. You can do this with anything like push-ups or chest press or different things. You can adjust the angle that you're working with so that it's a little bit more comfortable for you and doesn't irritate the joint as much. We can also do this with different exercises. Like let's say you want to do burpees, but you know your knees can't keep up with something like that. It's too high impact. Well, we're looking to reduce the pressure on the joint, right? What if we can make burpees a low impact exercise? You can get the same cardio benefits, but make it low impact. An easy way to do this is do the same burpee type motions. You're going to get into a plank, but instead of jumping and bringing your feet forward with that explosive power, you're just going to step them forward. Step the right foot forward, step the left foot forward, and then stand up instead of jumping up. When you stand up, you can do a little calf raise to kind of simulate that jumping movement, and then return back into the plank position and do it again and again that way. We've eliminated all of the jumping out of the exercise, but it's still going to get your heart rate up, so you can get a lot of benefit out of this exercise. A lot of times, if we make some small changes, you can do some of the same exact exercises that everybody else is doing, just with some small modifications, and you're going to feel a lot less pain and still get a great workout. The third thing we can change is reducing repetitive movements. If you're someone that likes to jog, for example, or run, and you have a bad knee, that is constant, continuous pressure on that joint as you're running. It's just so repetitive. We want to try to reduce things like that. You can do it by maybe doing an elliptical, which is a similar motion, but a much smoother gait, maybe a little bit less on your joints for you, a little bit less pressure and intensity on the joint. You can also do some static exercises, like a plank. Planks are great because there's no real reps in a plank, but try to hold a plank for a minute and you know how difficult that can be. It's a great exercise that you can make more and more challenging by extending how long you do the exercise. And you can do multiple sets of it as well. So something like a plank, or you can do a wall sit, which kind of simulates a squat. You're going to be in a squat type position, but with your back against the wall. And you'll find that it burns, am I telling you? So like that one really, really gets you going. And it's a great exercise, but what you're doing is while you're getting all the benefits of that burn and the challenge of the exercise, you're not having this constant up and down on your knees that eventually wears them out. If you're someone that finds maybe that first set didn't hurt, but the second or third set did, and that your joints just kind of wear out as your exercise progresses, then maybe looking into some static exercises would be a good option for you, as it's going to cut down on that repetitive motion and allow you to get the benefit of the exercise, but in a static, stable position. So these are some really simple tips, guys. There's, of course, a lot more things out there you can do to modify an exercise to work for you. But of course, it's difficult to get into that because there's so many different injuries out there. Hip replacements, knee replacements, arthritis, so many things that it would be crazy to try to put in one video. So again, I recommend if you get with your doctor or physical therapist, you can probably get some more detailed, specific for you advice. But this is real general stuff that applies to your common aches and pains or recovering from an injury, things like that. And if you're a young person watching this, definitely share this with your parents or aunts, uncles, people like that that may be having some of these difficulties that are holding them back from exercising. That way they can know that you can exercise even if you're having these challenges. You just gotta make a few changes. If you have questions for me, definitely put them in the comments below. I'd love to answer them, or if you have any feedback or ideas, I'm posting now every single Tuesday, so the next Tuesday you can expect a new video from me. Definitely like and subscribe as well. And thank you so much for viewing. It's been an honor and a pleasure for me to be able to share with you this information, and I really hope it helps you. Thanks for watching.